Hello and welcome to Birth Talk with Lynn and Laura. Today we have Laura Shanley, author of Unassisted Childbirth. We had a nice conversation a few days ago, so we thought we'd do this again. Hi, Laura.
Hey, Lynn.
We would like to talk about redefining normal childbirth. What is normal birth? What are we talking about when we say normal? So I think we're just going to talk about what birth involves, what is normal, it's a lot of misconception, preconceptions, and I guess, oh yeah, so I'd like to welcome, I don't think we have anybody on yet. So welcome for joining us. Please type in your comments. I will respond to them and we can have a conversation going here. Anything you want to share while we're talking about this topic. And as I was working out this morning, I thought to myself, customary. The word customary came to my mind, and American childbirth has adopted these customs that we then think are normal, what a woman will expect at birth. One film that I liked many years ago, it came out almost 10 years ago, The Business of Being Born, produced by Abby Epstein and Ricky Lake. And they talked about hospital birth and how it seemed normal that 90% of patients who went in to give birth were having an epidural. And so what is customary has implanted in women's minds what is normal and what they can expect. So that's just something that came up in my mind today, the word customary, what customs we've adopted surrounding birth. But anyways, this is not really any kind of a scripted talk. This is just an informal general talk, but I knew that when I said, Laura, we should talk again about birth. What do you want to talk about? And she said, redefining normal childbirth. So what are your thoughts on the word normal and this whole topic?
Well, I kind of feel with my births that it's sort of been there, done that. Like my births have been each one of them has been so different. With my first one, it was a face presentation. Second one was a footling breech. Third baby was posterior. And in all of those cases, there are doctors who would have sectioned a woman for that. So, and yet, and part of it is I didn't know that they were going to be in that position. And so I didn't prepare and do the things that they say you were supposed to do, which generally, if you go the medical route, they'll just say, okay, C-section, or maybe not so, definitely for footling breech, but also I've heard of it done for the other births as well, for those other positions. So I think so much of the time that things can go wrong when the baby is in what they say is the wrong position, is the panic that ensues. Like, oh my God, the baby's coming out breech, we've got to do something. Like people panic. And of course, we've talked so many times about fight, flight. And when you panic, you are basically shutting off birth hormones. You turn on the stress hormones, you shut off the birth hormones. And so, yes, then babies get stuck because you are depriving them of the blood and oxygen. You're depriving the uterus of the blood and oxygen, and the baby, you're also, cutting off the supply to the baby. So yes, babies can become stressed, but I think people underestimate what happens if you can remain calm. And I never advise people like, okay, this is what you do if the baby's coming in a face presentation, or this is what you do if the baby's in a breech presentation. I really encourage women to do their own research, but also to listen to their intuition. When I gave birth to John, my first, I reached down, I felt his face, and I didn't even really think about that until years later. And someone said, oh, John was a face presentation. I'm like, oh, yeah, I guess he was. But I felt his face at my perineum. And so then I went over to the bed and I was about to turn over because I was thinking I'd give birth on my back because I thought that's how women give birth. And so, but then I heard an inner voice say, don't turn over. And I didn't. And he literally came flying out, and my husband caught him in midair, and while I was on my hands and knees. And so with that, and everything was good.
Right.
With my second birth, I had planned on giving birth on my hands and knees because I thought, oh, well, that's how that's how baby should be born then, rather than, no, that was how my first one should be born. Right. But then I had a dream, which is another thing that I write about you have many natural resources you can tap into. Dreams are one of them, and they can give us guidance. And I'm not necessarily saying listen to every dream and do exactly what it says, because I think some dreams are more symbolic and some are, actually giving you some guidance, and you need to really learn to determine what that is for you. But in my dream, I saw a woman giving birth. She was standing, she was catching the baby herself. And I heard a voice say, tell her to remember not to do too much. And she was standing over a little plastic baby bathtub. And the dream was so powerful. And I felt like in the dream, oh, I get it. It's not a matter of, reading up on everything you're supposed to do and then pushing and panting or doing this and that. It's really kind of understanding what it means to step aside and let that same part of you, or that same consciousness that grew the baby, complete the process, get the baby out. And so basically when I went into labor with him, I had decided I was going to stand over my little bathtub. And so I had a very short labor, maybe 2 hours from the time I felt the first contraction. I was walking across the room. My water broke. After my water broke, I didn't feel anything. I reached my hand inside myself and I could feel my muscles contracting, but I wasn't in any pain, which was different. I didn't have tremendous pain with any of my births, but that one especially. And so I just was like, okay, well, I'm just, my water broke and then a foot came out. And he wiggled his toes. He was kind of just moving his foot around, like testing the water. And my 2-year-old John was standing there, and he pointed to his foot and he said, what's that? And so he just was moving his foot around. And David, my husband, said, what do you want to do? Do you want to go to the hospital? And I felt like if I go to the hospital, that's going to be a C-section right there. I did not want to go to the hospital. I really felt confident in myself and that I did have inner help. And I basically just stood there and waited. And then his foot got lower and lower in the next few minutes. And then his other foot popped out. And then something just said the time was right. And I gave sort of one push-pull and pulled him out, or pulled him out. So it wasn't a tremendous effort. It was kind of a gentle push-pull.
Yeah.
So then when I was writing my book 12 years later, I remember reading that Michelle Odent says babies can be born, breech babies can be born vaginally, but 2 key things to keep in mind is to do absolutely nothing to interfere and to keep the woman in a standing squat or upright position. So I felt that was what was conveyed to me through the dream. I didn't have a dream that said you're having a breech baby, because I think that probably would have caused me some concern. Yeah. A friend of mine did have a dream that he saw the baby inside me standing right side up. But anyhow, I just kind of, went with my intuition and tapped into my dreams. And that was what felt right for that birth. Yeah. So, it was very, very my easiest birth, really. And then my next one with Joy, I had a longer labor with her, but I didn't even realize she was posterior, which means her face was facing my front rather than facing my back. She came out when I was by myself, and I remember looking down and seeing her face still inside the water bag. I was looking at her through this film. Yeah. And it was so beautiful. We just looked at each other, and then my water broke and I caught her. But I didn't even really think about she's a face presentation. I mean, not face presentation, that she was posterior until years later. And someone said, oh, she was posterior. Yeah. Because I've just never really focused on those things. Yeah. So, but here again, I think everybody needs to do what they feel comfortable doing. So in my case, I really worked with myself mentally.
Mm-hmm. I find that interesting. I find that interesting that you just instinctively knew not to interfere. You would have interfered with the flow. And so sometimes maybe too much research and knowing all about the details is not a good thing. And that the good thing to do is to pay attention, because the baby initiated the movement out into the world. And I think the baby has an intelligence to continue the process to safety. this is the funny thing. We don't give those babies enough credit. We think that the mom is the center of the experience. It's all about the mother. It's all about the mom doing what you want to do. To me, I think it's mostly about the baby. When's the baby ready to make its way out?
Right.
You know, with a little help from us. But for the most part, the process began by your children, and the process, you know, flowed right on through. And it's like you said, when we panic, we mess with the process. And for those of you tuning in, welcome. We have a few more people on the call. If you don't know Laura Shanley, she's author of Unassisted Childbirth, and she's talking about some of her births where she had at home posterior presentation, a footling breech, and it is possible, and it's nothing to get overly anxious about, where you need to call 911 and have paramedics arrive to treat it as an emergency and rush you to the hospital. So
you talked about the baby also helping in the process, and I remember after my footling breech baby, after Willie's birth, I had a dream that he was saying that he helped in the birth too by not being afraid. And I think the baby is always, they're picking up on our fears. So if we can sort of send them positive messages, and certainly, you know, everything that we're thinking has a hormonal response. So when I'm calm, I'm putting out those calm hormones, and so I think, you know, he picked up on that, and so he wasn't afraid. I think even things like when you think, oh, this is a terrible world, you know, I'm not so sure I want to bring my baby into this world. It's like, no, you really have to have a positive attitude and trust that, and especially now that, you know, we will recover from this, and life will be good again. And there are good things every day, you know, and that's what we need to focus on.
And things are always changing. Things are always changing. I met somebody in 2008, and they said, we only want one child. The recession, it's horrible. The economy is terrible. So I only want to bring one child into the world. And I just kind of thought, I feel sorry for you. You're missing out on joy. You're letting the economy just give you your decision making for your family. But that's on some people's minds. They look at what is going on in the external world, and then they're going to go ahead and plan. My births, my first 4 were in the hospital, and the last 2 were at home. And I'm thinking of the birth of my daughter, Hillary, my 3rd child and 3rd hospital birth. And so 6:30 in the morning, I was feeling some contractions, and I called up the doctor. I think I'm in labor. And he's like, oh, get to the hospital right away. The 3rd babies have a way of sneaking up on us and coming quickly. And I'm like, oh, okay. And in that practice, I wanted this particular doctor to deliver the baby. And at 6:30 a.m., he said, I'll meet you at the hospital. Okay. So here I am thinking, he said he'd meet me there. So we wake up our other 2 kids. We drive them over for babysitting. I'm just talking normally. I'm not in any rush. And so by the time we got on the road, it's 8:15, and we're headed to the hospital 20 minutes away. And there was a school bus, and there was a light snow. This was in New York. And then I started really feeling some major contractions, and my husband was talking to me, and I was like, oh, I couldn't talk. And he knew I was very well advanced if I couldn't talk, and I just had to focus. And so he was kind of trying to, speed to the hospital, but the bus was stopped in the way. So we got to the hospital. He parked far, far away, and I got out, and I'm walking slowly into the hospital, and I get in, and they look at me, oh, do you need a wheelchair? Oh, I don't think so. And we went up in the elevator. So at 8:30, we signed into the hospital. The doctor was not the doctor who I talked to at 6:30 in the morning. It was one of the associates. And she said, oh, let me get a urine sample. Let's see how far you are. And I go over to the toilet, and I'm like, oh, my water just broke. She's like, well, come on over here. So I got up, and all of a sudden, Hillary was born at 8:42 a.m. within 12 minutes of being at the hospital. And I look at my husband, what just happened? I didn't really feel much pain. I didn't have to push her. She just slipped right out. And the female doctor who had one 2-year-old who had a C-section, the New York humor is sarcastic. I hate you because birth was so easy. And I'm like, don't hate me. Here I just had the baby born, but it was outside the realm of normal, what we think is normal. We think that the woman has plenty of time. She'll have 12 to, I read in the books, 14 to 16 hours of labor. You will know 5 minutes apart, then it will become stronger. And I thought to myself, I never want to have 14 to 16 hour labors. I want them, it's going to be shorter for me. I'm in shape. I'm taking care of myself. So I never, the textbook told me what was normal. And I said, I don't want that to be part of my normal. So all of mine were three hours from start to finish. But it was it's really demotivating. You're there having a baby and the doctor, I hate you, oh, it's so easy for you. And then the word got around to the hospital staff that, wow, that woman just came in and within 10 minutes, her baby was born. And so because it wasn't normal, what they usually see, it was now not like a celebrity birth, but it was something they were talking about. And so I didn't really want that attention. I was like, really? There's, is birth some big production and some big drama? And sometimes, yes, it is some big drama because everything around you creates it to be a drama.
Right. Yeah. I mean, I think we have to, modern medicine has always had to catch up. It's like when people were, women were dying of what was it, when they weren't washing their hands, and people were dying, and then eventually they, the person who was saying wash your hands was put in a mental institution.
Yeah.
It's like, so I think those of us who I believe are on the cutting edge, it's like we cannot look to society to tell us, yes, what you're doing really is good. I think it's just I remember when I was giving birth, I just realized my iPad only has 10%. So
well, let's see if you can plug it in. Okay.
So now I'm walking through my house.
Okay. Find the plug. All right. So, yeah, I can't really hear you at the moment. All right. So I can't hear you at the moment. So you might want to plug in for more power. But yeah, while you're walking through the house. So welcome everybody who are watching so far. Thank you for your positive comments. You appreciate the work that Laura and I do. Well, we are very committed to childbirth because childbirth it's feminine. It's part, I don't know, it doesn't define who we are, but we as females have this awesome power to give birth. And when you really think about it, it's an incredible responsibility. It's an incredible experience and direct participation in life, in our families. And so childbirth, your birth experience will be something that you remember for the rest of your life. And it's worth thinking about, and it's worth approaching in a serious manner and not letting others define for you what is normal or define for you what it should be. And all too often, women don't really know that birth, the birth culture sort of defines birth for you, right? You call up a doctor, you go to the hospital, give you the ultrasounds. They tell you how things are going to be. They tell you who can come in to the delivery room. They tell you how long you'll probably stay. They might tell, your insurance company might tell you, oh, go take this childbirth class. And when lots of times the benefits you will get in life are when you pay extra money and take a Bradley childbirth class. You take a class about nutrition that is not covered. So a lot of what when we say this word normal, it's customary. What do we have in place that the insurance covers? Insurance companies will allow, this word allow, what they will allow for you to do. So normal is not what somebody else will allow or will tell you. Actually, Laura, normal, maybe there is no normal birth. Birth can happen an hour for some people. Some women are up to 44 weeks gestation, and that's normal for them. But our culture will tell you at 39 weeks, we're looking at our watch, we're looking at the calendar at 39 weeks. You need to go ahead and get ready for a, can we meet? Wait, stop. Hi, Joy and Ella. Joy.
So this is Joy was my posterior baby, and this is Ella, and Ella was born at home. You say hi?
Hi. Nice to meet you. Hi.
Say hi, nice to meet you.
Yeah, sweet. Very nice. Thank you. Oh, so thank you. So normal, a woman could be 42 weeks. She could be 44 weeks. In those cases, you have to be your own advocate. There are some midwives, there are doctors who will say, oh, we can't have this. This gets dangerous. This gets dangerous. You are too long and it introduces more possible problems. And another thing too, I really don't like the term high risk. Just because you're over 35 and you've never had a child before, you are going to be placed in what some people will say is a higher risk category. Or the mom who's had 4 C-sections and maybe she's over 40 will be considered higher risk. And then with that comes protocols of what the medical folks think should be normal. Now, granted, there could be some research that will say there's a possibility of issues that could happen, but you know, you are special and unique. You might not be in those statistics. I know many things about my life. I blow out of the water whatever statistics you wanna ascribe to many different things about my life. So anyways, so I see you're all settled. Okay, so what else do you want to say about normal?
Let's see. I know I was talking about something before I got that message saying my iPad was. Do you remember what that was?
We were kind of talking about your births. I think we were on Joy's birth. I don't really remember.
Oh, well, I think it's just about like that society. We can't. You know, they lag behind. I know what I was going to talk about. Episiotomies. I remember when I wrote the first edition of my book, they were still routinely doing episiotomies. And now they don't do them routinely anymore because they realize that that actually initiating a cut can lead to a bigger tear. And so, but you know, back then people were, if I were, you know, questioning episiotomy, no, you don't question doctors. You know, doctors have this like godlike, you know, people. So many people look at them in that way that modern medicine and the doctors are not to be questioned. And I think, you know, as I've said many times, yes, you know, emergency medicine is great, and most doctors, I'm sure, are caring people. But in the world of obstetrics, I feel like people are going to look back on this time as a barbaric time. That, you know, 30% of women are being cut open to give birth. No, this isn't. This isn't safe. This isn't what we're supposed to be doing. And so, but I think, you know, people don't realize there's a whole nother side of them, that, you know, they can tap into their intuition and their impulses, and that we do have that inner guidance. And so we don't have to just turn ourselves over to the medical community and say, oh, I know nothing. You know best. Tell me what to do. It's like, and women who have given birth unassisted accidentally, I've heard some of them say, you know what, because no one was there, I had to listen to that intuition, and it didn't fail me. You know, that voice was crystal clear, because I didn't have people surrounding me telling me that, you know, what position I should be in, and then, you know, counting.
Push.
Yeah, right. That you have to count to 10, and you know, and then I mean, it's like, no, you can't put these arbitrary things on birth. It's any more than you can on sex. You just need to learn what works for you, and trust that your body is working with you, your baby is working with you, and we do have that help. And you know, do your research. But you know, for me, the research was mostly about the mind-body connection. You know, I really didn't do much research about how to give birth. I always felt like I was kind of going to move out of the way, and that something else would sort of take over, and I just wanted to cooperate with that. And
It's all about having confidence in your body and confidence. And I've noticed today on various Facebook threads, whether it's about family or birth, there are a lot of women who say, tell me what I should do. What do you think I should do? Even what should I name my son or daughter? Give me some ideas. What should I do? And I don't think these are the questions we should be asking, but
right.
I don't want to be critical, but there's something I wanted to say about episiotomies. I didn't really know what an episiotomy was. In 1988, I had my firstborn in the hospital. And again, I went in, I wasn't in the hospital for very long, and the doctor showed up and I was well on my way to giving birth. And he says to me, okay, like, hold still. I'm just going to do a little cut. And when he cut me, I was like, that hurt more than any of the labor pain I had.
Yeah.
It hurt more when the baby was being born. It's actually a very juicy, slithery, wonderful feeling. I'm so happy I got to experience that 6 times. But the baby usually slips right out. The head comes out. It might hang out there for a couple of seconds. And then the rest of the body, the shoulders, once the shoulders get through, boom, it slides out. It's not painful. What might be painful for me were some of those contractions and getting very close to giving birth. So I had this little cut and I was like, and it just was like this stinging, burning feeling. It was very painful. And the baby was born. And then he didn't really want to wait around for the placenta. So he was mashing my abdomen down and pulling out the placenta so they could clean me up and get going. It was like 1:40 in the morning. He wanted to leave and get back home and clean up the area. So that was my first experience. And then I started asking women about episiotomies. Well, first of all, then the instructions were, okay, no sex for 6 weeks. I'll see you in 6 weeks. And I'm like, oh, okay. And I guess 6 weeks, your body is supposed to heal. And then you get permission from your doctor to resume sexual relations. That was another humorous thing. I thought, wow, these doctors are telling you when to avoid, and okay, I'll give you the green light after your 6-week appointment. And I once asked him, well, why do you say that? And one doctor said, because we don't want you getting pregnant right away. And I'm like, that's not for you to say. So I was like, oh, that was weird. So with that episiotomy, in talking to other women about birth, there are horror stories out there. There were stories where episiotomies were too deep and too bad. And one woman I met, she said, oh, my episiotomy was so bad. I don't know what degree it was, that she had to avoid sex for 1 year. She was in pain in that area for a year. I find that unacceptable. That's ridiculous. Mm-hmm. That's horrible. So some episiotomies go okay, some don't. They're painful and they're unnecessary. And I think our country is good with that. I don't know if it's down to 10%. I think episiotomies are much lower, but the C-section rate is still high. And the rate of so many other interventions are still very high.
Yeah.
So, what is normal? And does anybody here on this call right now have anything to share about your births? What was normal for you? Another thing in the hospital, what is not normal is to give women food and water. You have these ice chips. I don't know if it's still the same. And the reason they told me no food or water is because in case we need to give you medication, having food and water in your system could make you vomit or interfere with the medication. So women are told, at home though, I was able to drink pineapple juice or eat something all during labor, right up until the birth if I wanted. So again, the word customary comes to mind, that the American birth and other modern first world countries have adopted these things about birth, where many young women in their 20s getting pregnant for the first time, they think it's normal. They talk to their sisters and their friends. Well, what was your birth like? Well, what was my birth like? Oh, look at this nice ultrasound picture. Oh, well, I went in and they had this and they didn't have that. And what about the woman who wants a water birth and water? Many hospitals do not have a tub or a water birth facility set up for you. So you have to actually give up what you might want, all because of, well, we don't do that here. This is a protocol. This is not allowed.
Right. Right.
Okay. Well, what else? Normal. When I was a psychology major in college, and I thought I wanted to be a clinical psychologist. And so my third year, I took a class called abnormal psychology. And abnormal psychology, we studied things such as catatonic, schizophrenia. At the time, they called manic depressive. We call it bipolar now. So there were all these labels to behavior that either were initiated in the brain or the behavior that were abnormal. So we could say that in normal human relationships, we expect certain conversation, we expect certain behaviors. And so the word normal sort of has guidelines to go with it. But when we think about childbirth, I think if you just asked any young woman in their 20s, their view of normal would be, it's going to be very painful. That's what I see in the movies. That's what I hear women talk about. And women's stories don't help. Oh, I have 2 kids and I don't want any more. It was horrible. I'm so glad to be over that. Oh, I love my baby, but I hated being pregnant. I didn't like it. I was nauseous. That's another thing. Nausea doesn't always go along with pregnancy. It doesn't always go along. Another thing about normal is you might estimate your due date. The due date is not the date that the baby's going to appear. It could be 2 weeks early, 2 weeks later than what you think. So we have this whole, I really believe, Laura, when it comes to birth, that we have to be very wide open into accepting different outcomes and experiences.
Mm-hmm.
And so, we just
Right.
don't know. And I know what I was going to say. The American culture is not good about leaving things open. We want to control. We're very analytical. Another phrase in the birth industry is evidence-based. And I'm not very big on evidence-based. I don't really need studies to tell me and give me permission. Evidence-based. I just read a book encouraging midwife home birth. I don't want to say the title of it because I didn't really like it, but it was all about evidence-based. Make sure you've met with your doctor and got your doctor's permission before you can have a home birth. Check evidence-based. You are being irresponsible if you don't have a midwife. If you attempt this on your own, if a husband and wife attempts childbirth on their own, that's not normal. That's a little wacky because look at all the evidence-based we have, and if something were to happen. And I'm kind of like, okay, so you're defining to me what I should do with my life. You don't even know my body. You don't even know my confidence. And, so this word evidence-based is almost a bullying. It can be used as a bullying phrase to people. You must have evidence-based. You must act in accordance with whatever is evidence-based. And so we can point to probably at least 5 or more drugs that were evidence-based at first that became very harmful. The Gardasil.
Right.
There was, I think, the fen-phen. People who went on diets 15 years ago were on this fen-phen. The thalidomide or whatever caused birth deformities. How about the flu shot for pregnant women? I think they've stopped that for pregnant women, but the push to have all these medications and you could see it coming now after this virus. They're probably going to come up with something and they're going to really I think they're going to push hard. Everybody should get this immunization for this coronavirus. I think in our culture, in our world, the way it is, we're going to have mystery illnesses, mystery viruses. So I don't know.
I think with the evidence-based too, when people use it as far as, okay, how many women who planned home births transfer to the hospital, and okay, but then you have to look at, well, that statistic really doesn't tell you anything because why did they transfer? A lot of the time they're transferring because the woman is afraid and in pain and her fear is causing her to be in more pain. And so they transfer for exhaustion or they transfer because her water has been broken for so many hours, and according to the laws, they have to transfer a woman. So it's not that they're transferring necessarily because there's a true emergency. So I think when you look at this evidence, it really doesn't tell you much in a culture that doesn't understand the mind-body connection, doesn't understand that how many of the laws regarding childbirth are arbitrary, they're different in different states. And so, and basically, if you're terrified, you may have a problematic birth, and you may have it at home or you may have it in the hospital, but it doesn't to say that then this problem happened and it was because they were at home, or it could have been different if they were in the hospital. You just don't know.
Right.
And so, if we're going to wait until we get the studies that show home birth is safe or unassisted birth is safe, in sometimes there are studies that do show it, but that's not the studies that OBGYNs are citing or the media is citing.
Right.
Some studies showed something about home birth that a lot of people quote, and I'm sure that a lot of these studies have been taken apart by people and really questioned, but the same studies are quoted time and time again. Yes, you can have a home birth, but this is more likely to happen, or you're twice as much, this is twice as likely at home. And I think you just can't live your life based on statistics. They just aren't accurate, and they just don't take all these other factors into consideration.
I agree. All right. Well, I don't really have any other remarks about normal childbirth. Just that, again, I just wanted to tell women to childbirth is unique and individual. And so who's to say what your birth should be like? It's going to be different for every woman. Each birth is going to be different. If you have 6 kids, you probably have 6 different birth stories. Even if you've consented to 6 different C-sections, there's going to be different things that happen with each individual one. And let me just read a comment. I've gotten a few comments. Mostly were positive. Thank you, Heather and Susan. And Heather writes, the evidence-based became such an important concept in our culture because of the need to prove to doctors or hospital staff to advocate in order to have some desires in a hospital setting. It's also part of improving birthing policies in the hospital, but it's a business. Hospital is business, and medicalized birth is big business. That's a good point. That evidence-based it helps create protocols and create medicalized birth. And scientific, yes. We are way too analytical and scientific in our approach to life. We need the intuition. We need the emotions and the feelings to be interspersed with the analytical approach to living. We are really missing out. I think that would be a great talk about family and motherhood. And Jody McLaughlin is going to come on and talk, and I'm sure we'll talk about mothering and just the women's intuition and the respect for the woman and the female and the nurturing and the intuition and the feminine power is almost kind of flattened a little bit, and not really appreciated.
Right.
So, all right. Well, thank you. Thank you so much. I've enjoyed this talk. Redefining normal childbirth. Any other concluding comments or anything? Okay. All right. Well, thanks. Have a great day, and we'll see you next time. Bye, Laura.
Bye-bye, Lynn. Bye, everybody.